To begin this part of the assessment, briefly inspect and palpate the external part of the patient's nose. It should be fairly symmetrical, with no lesions, deformities, or deviations. Now have the patient occlude one nostril as he inhales and exhales. Air should flow freely in and out of the other nostril.
Good.
If the patient reported an impaired sense of smell during the health history, test the olfactory nerve by having him identify specific smells with his eyes closed. As he occludes one nostril at a time, pass an aromatic substance like vanilla, cloves, or coffee under the unoccluded nostril.
Coffee.
Next, inspect the nasal cavity using an otoscope with a short, wide-tipped speculum. To widen the nostrils, apply gentle pressure on the tip of the patient's nose with your thumb. Then tilt his head back slightly and insert the speculum gently into each nostril. Avoid contact with the sensitive nasal septum. Hold the otoscope handle to one side to avoid the patient's chin and to improve your mobility. Direct the speculum toward the back of the nostril, then move it upward in small increments to view the nasal cavity. You should see coarse hairs lining the anterior surface and a ciliated membrane lining the posterior surface. Throughout the nasal cavity, the mucosa should appear pink and moist, and you should not see lesions, drainage, or obstructions. Now inspect the nasal septum and note any deviations, inflammation, or perforation. Remember, though, that a deviated septum is normal unless it obstructs airflow. Finally, inspect the turbinates, which are located laterally. They should be light red without any swelling, exudate, tenderness, or polyps. Now ask the patient to bite down and bare his teeth while you assess jaw alignment. In the front of the mouth, his upper teeth should override the lower teeth slightly. Before examining the mouth, ask the patient to remove dentures if he's wearing them. Inspect the patient's lips. They should be moist with normal color. You should not see lumps, ulcers, cracking, or scaliness. Ask the patient to close his mouth. The lips should close symmetrically. If you see any suspicious lesions, palpate the lips, which should feel soft and smooth. Be sure to document abnormal findings. Then assess the oral mucosa, using a tongue blade and light source. Normally, the mucosa is pink, smooth, and moist, with no lesions or nodules. Remember that in a dark-skinned patient, you'll commonly see increased mucosal pigmentation. Next, assess the patient's teeth and gums. Normally, adults have 32 evenly shaped ivory-colored teeth that are firmly embedded in the gums. Now inspect the rest of the oral cavity. The hard palate should appear bony and whitish. The soft palate should look muscular and pinkish. The uvula should be pink, midline, and free of lesions. Next, inspect the tongue. The dorsal surface should be symmetrical and slightly rough, with a midline groove and small fissures. The ventral surface should be smooth and pink, with visible veins. Using a gauze pad, hold the patient's tongue to one side and palpate the floor of the mouth. You should feel no lumps or indurations. Next, ask the patient to stick out his tongue. It should be midline and free of tremors. Place the tongue blade at the side of the tongue and ask him to push it away. Tongue pressure should be equal on both sides. These actions test the hypoglossal nerve. Check the glossopharyngeal and vagus nerves by depressing the tongue and having the patient say, ah. The soft palate should rise symmetrically, and the uvula should stay in the midline position. Instruct the patient to say, ah, again, and assess the pharynx and tonsils. Their mucosa should be smooth and pink. Grade the tonsils' size on a scale from +1 if the tonsils are visible to +4 if they touch each other. If the patient reported an impaired sense of taste during the health history, assess his facial and glossopharyngeal nerves by having him identify different flavors.
Now tell me what you taste.
Cinnamon.
That's right.
Lightly touch the back of his tongue with the tongue blade. He should gag. This test assesses the glossopharyngeal and vagus nerves.